What's the cost of a vision problem that affects school or life? What's the cost to solve those problems? Hello, I'm Dr. Moshe Roth. I'm a developmental optometrist. I'd like to answer 4 common questions. What's the cost of my or my child's vision problem? Won't my child just grow out of this? What's the cost of vision therapy to solve those vision problems? Will insurance cover this? Some vision problems cause poor reading comprehension, poor schoolwork and homework, poor self-esteem. These are the real costs. Sometimes these are misdiagnosed as difficulty concentrating, inattentiveness, ADD, ADHD, learning disability, dyslexia. Don't glasses solve all vision problems? No. Glasses simply focus the light onto the back part of the eye, but they don't change how our eyes work together as a team or how we track across a page. Let's address the second question. Won't my child just grow out of these problems? We develop skills such as riding a bike or driving a car, playing piano or playing a sport. We have to make the effort to develop these skills. You don't grow out of these skills, you grow into them. Vision is also a developed skill. Some people develop these skills naturally without much effort. Others have to work to develop these skills. We develop the visual skills of learning how to use the 2 eyes together as a team, being able to maintain fixation, tracking across a page, and physically focusing. What can we do when these don't come naturally? Vision therapy helps people build the visual skills they've not yet developed on their own. Vision therapy solves problems that eyeglasses and contact lenses can't fix. The cost of a vision problem can be in time, in frustration, and in money. Time, meaning how long it takes to complete an assignment, or to complete homework, or to complete a test. Frustration, meaning if I can't do the task at hand, whether it's a school assignment, homework, or a test, I'll likely be frustrated. Money, if I don't develop the visual skills, I may not receive a scholarship that I could have otherwise obtained, or may ultimately earn less in a job. Vision therapy to solve these problems has a cost in terms of time. It requires time and diligence to develop and to perfect these skills, much as it requires time and diligence to learn how to speak a different language or how to play baseball. If we don't learn the visual skills, it can affect our ability to read, to excel in school, and ultimately even to get a better paying job. What's the dollar cost of vision therapy? Vision therapy costs about the same as orthodontia or braces. Fortunately, it takes about half of the time, and the benefits are that your child does better in school, has improved self-esteem, and these changes are permanent. Once someone completes the program, they own the skills, much as once somebody has learned how to ride a bicycle or drive a car, you own that skill. Vision therapy is a process. It takes time to learn and build and gain the visual skills, and there's also a financial investment to solving your problem so they no longer hinder you or your child. The 4th question is, will my insurance cover this? This question is on the mind of most people. It's a hard question to answer because each medical insurance company is different and each medical policy is different. For example, some medical insurance companies may limit you to only certain providers or only to certain hospitals. All medical insurance companies work with the definition of medical necessity, meaning what they consider to be a medical problem. They define medical necessity as an injury, an illness, or a disease. Often, medical insurance companies consider a problem that impacts learning to be educational and not a medical problem. The point is that vision therapy coverage is unique to every situation, and there's so many variables. Your medical insurance company ultimately dictates what they will or won't cover. And ultimately, if you have a problem, you decide if you want to correct it. The reality is, if you rely on your medical insurance to cover the problem, it may not get done. And you or your child may not get the benefits you really want. Although we expect school systems to fix problems that impact education, the reality is the additional services they provide, such as resource room, a 504 plan, or occupational therapy, will likely not solve an underlying vision problem. Again, it may not get done, and you or your child may not get the benefits you really want. Some people seek out the services of a learning center, such as a Sylvan, a Huntington, or a Kumon. But those centers only remediate or compensate and try to teach strategies. Wouldn't it be better to just solve the underlying problem? The decision is yours to help your child build the skills they need to succeed in life. We know what to do to help build the visual skills and exactly what sequence to do it. I'm board certified in vision development and vision therapy by the College of Optometrists in Vision Development. We know what medical insurance companies consider to be a medical problem. And we help our patients not only solve the visual problems they have, but we also help our patients obtain the benefits when the problem falls within a medical insurance company's definition. You or your child have a problem that can be solved through vision therapy. Consider concentrating on the big picture, meaning getting the help that you or your child needs. If medical insurance ultimately contributes to your care, that's great. We'd be happy to help you or your child solve your vision problem or their problem. If you have questions, we're here to help. Please call us at 732-679-2020.